Hello, I'm Dr. Barbara Bolen. Welcome to another edition of my low-tech video blog. So it's kind of funny, I saw Joy Bauer speak over the weekend. I don't know if you know her from the Today Show. In any case, at one point she was talking and she said to herself, well, I wrote a book, so I thought, why not do a TV show? So I was thinking, oh my gosh, this woman and I have so much in common, right? I'm thinking, I wrote a book. Why don't I do a little video blog in my little office with my iPhone? Of course, I don't have the personal trainer, I don't have the makeup artist, and I do not have the teleprompter. And so for those of you who watched my last edition, you will see that there was a couple of moments of dead silence when I completely lost track of what I wanted to say. But I just smiled sweetly. Hopefully you continued listening, didn't hit the delete box, and kept on going. In any case, today what I want to talk about is happy life, happy belly, happy life. I recently added this tagline to my website because I thought it really does encompass, the spirit of what my work is all about. Now the thing is, we could take happy belly, happy life on two different levels. So at the very first level is that most of you who listen to my blog here or who have been following my work have IBS. And so you know how hard it is to have a happy life when your belly is not happy. You're in pain, it's unpredictable, you don't know when you're going to have an incident, you don't know what you're supposed to be eating. Very difficult to have a happy life under those circumstances. But I think that there's also a deeper level of happy belly, happy life. And in a weird way, it sort of gives a silver lining to what's happening to you with your belly or what your body is doing to you with your IBS. So let me talk a little bit about how I came to have these thoughts and why I'm sharing them with you today. So last week, I just happened to have two conversations with people in which the conversation was sort of like on a similar subject, but it was just totally coincidental, and neither of them were talking about belly issues. So the first was a person who all of a sudden found themselves with this inexplicable overall body rash. At first, it was concerns that it was some sort of strange cancer. Luckily, that was ruled out, and instead, allergy testing is ongoing to see what's really going on with this rash. And this person said to me, I realize my body is talking to me. I just have to figure out how to listen. Then the second conversation was with a person who was having lots of sinus problems, ear infections, dizziness from all of the pressure and inflammation in the sinus and ear area. And this person had an interesting observation. This person said to me, I know that I have not been taking good care of my body, but I really thought I had until I was much older before it was going to catch up with me. Now I'm realizing that I need to make the changes that I need to make now so that I feel better now because my body is not happy with the way that I've been treating it. So that brought up the point that our bodies are very resilient. They put up with a lot of punishment from us in terms of unhealthy ways of living, unhealthy food choices, not enough exercise, without really squawking. But it does eventually catch up to you. For many people, it catches up in old age, right? And so you see people, they need stents. They need diabetes medicine. They have tremors. Their bodies are all hunched over. They're in chronic pain. So this is the result of sort of many years of not giving the body what it needs in order to feel well and thrive. Now here's an area where doctors aren't all that helpful. So doctors look at the what. They just want the label. Let's give you a label. You have diabetes, you have IBS. And then let's look at the protocol for the treatment. Where doctors fail short, and I'm pleased, I think that doctors are amazing, wonderful people, and thank God we have them. But the area that they are not really trained to address is the how. How did this happen? And how can we make it better? And this is where a coach comes in. Because what a coach can do is work with you individually to figure out what is your body trying to tell you, what foods is it that your body needs, what changes in your life do you need to make in order to bring about that sense of happiness and quiet from a body that's feeling well, getting good fuel, being well taken care of. The other area where a coach is so helpful is that sometimes we know we want to take better care of ourselves, but we don't quite know how to do it, how to motivate ourselves, or more importantly, how to persist in motivating ourselves. And again, this is where a coach can help to work side by side with you to make changes in a way that they're so easy, they're so fun, that they just become second nature. It's not something that you have to work at. So I told you I would talk about a silver lining to your IBS, and here's the silver lining. Anything that you do, any changes that you make in a healthy way to address your IBS, in other words, anything that you do that's going to increase the health of your gut, is actually going to end up increasing your overall health. The newest research is finding that things like, all skin problems come from the gut. Nothing's ever all or nothing, but a lot of skin problems come from the gut. So things like arthritis, any autoimmune disorder, any health problem that has to do with inflammation, all of these are related to gut health. And so when you make the changes to make your gut a healthier place, make your belly happy, you are actually going to be helping your entire body to be happy or healthy. More healthy than it is right now. So I invite you to figure out what is your body saying to you and how you can give it what it needs. I am here to help. So whether you work with me individually or you choose one of my more affordable group programs, I promise you that in a very surprisingly quick time and in a way that doesn't turn your whole life upside down, but just gradually, step by step, you start to treat yourself in the way that your body is asking, you are going to end up with a body that is happy and a body that is quiet and a body that is grateful for how you are caring for it. And so that when we take that happy belly, happy life to that deeper level, what we come out with is happy belly, happy long life. Doesn't that sound good? All right, till next time, I'm Dr. Barbara Bolen, and we'll speak soon.